So dieting is a wrong concept. Knowledge about medicine is the most valuable thing everybody needs to know. Everybody in a social media has become a doctor now. Trust issue is the biggest problem. People are doing doctor shopping every day. The problem with today's diet is we have completely forgotten about how to eat, what to eat, and when to eat. I see a lot of posts which comes up with protein diets, eat lots of fats, leave carbohydrates completely. It's absolutely absurd. Your body needs carbs, your body needs proteins, fats, minerals and vitamins, but it has to be on the right quantity. India is going to be the hub of diabetes by 2025. So there are lots of information that baffles me, anxiety in me in knowing that there are so many misconceptions and so many wrong understandings which is prevalent in the society. What is going to be the outcome?
Dr. Bhagya, hi. When I started thinking of making a podcast, the first person who came to my mind was you. And when I floated this topic across you, your passion that people need to know more information and valid information was, it just came through in our first conversation. I want to know why you feel it is so important that we have a podcast like this, which is informative to people.
Hi, Rashmi. Thanks for inviting me to this podcast. The importance of understanding knowledge about medicine is the most valuable thing everybody needs to know. Like you asked me why I started telling this to patients. The first thing started was when you have a clinic or when you have a hospital, you get lots of information from the patients rather than what you actually learn from colleges or medical schools or what you see on social media. There are lots of information which actually baffles me and which already creates a lot of anxiety in me in knowing that there are so many misconceptions and so many wrong understandings which is prevalent in the society. So I thought it was my responsibility to take it up to at least to my patients or to people who I know, that they should understand what exactly is happening with them or what exactly is happening with medicine and health. So that was the only reason when we decided to take up this podcast with you. We wanted to give the authentic possible information to the general public.
A
And this
little
is,
bit about yourself, doctor.
yeah, I started my practice. My education was all from India. My undergraduate medicine was from India, and then I left to the UK to study immunology. Immunology is a field of medicine which is evolving and which is, I would say, the need of the hour. Everything is in relationship to immunity. How your body responds to any bacteria or fungi or any circumstances for that matter. So that was my first specialty. And then I was transferred to diabetes by my professor, then professor. He was the one who actually introduced me to diabetes, saying that diabetes to India is going to be the hub of diabetes by 2025. So it is right time to you go and study diabetes, and then he transferred me to diabetes. And after that, I gained more interest into a specialty called radiology. I used to work with a professor for a specific procedure called islet cell transplantation. So islet cell transplantation is a method by which you transplant the normal islet cells into the patient who is suffering from type 1 diabetes. But we had to drop that project because of problems with teratomas and other medical conditions which are much more worse than diabetes. So I had to leave that, and that's when I was introduced to radiology, and I started getting my passion into radiology from then on. Right now, I have a hospital in Trichy in Tamil Nadu. We is an integrated hospital. I call it integrated because we try and incorporate as many methods of treatments as we could, so that the outcome of the patients are much better. And I also own a radiology in Australia, UK, and Malaysia. So this is what I do. And I am also a visiting professor in a university called Avans University of Medicine in Uganda, Africa. So on a humanitarian basis, I visit Africa every now and then. And all my post-graduations were in the UK and also in Australia. But I practice in India right now.
So, doctor, to start with, I want to understand for a layman, how should a layman decode health? There is so much information available. There are so many types of tests which happen these days, and how should a person go about decoding his health?
The first question is, why do you want to decode health?
Because one of the problems I find today is that there seems to be a belief that there is over diagnosis happening in the industry or in the medical among the medical fraternity. Everybody in general is reserved towards exposing themselves, or there seems to be a second guessing around doctors all the time. And also there is so much information available on the internet, so everybody thinks they know everything. So that's what I want to understand, like how should a person decode his health?
The first and foremost thing for every person, leave medical, non-medical, every person's point of view or patient's point of view. We'll call it, we don't have to address them as patients, we'll address them as individuals. First and foremost, whatever you see outside is wrong. I'll give you a very general example of this. You know what happens with the universe? For the past 5-10 years before, we were thinking universe is one and there were galaxies, but now we are in a point where we think there are millions of universes out there. So whatever science tells you today might be wrong in another 50, 100 years. So as a person, as a layman, do not follow anyone. I would tell you, follow what your body says. Follow what your systems tells you. If there is a problem, if there is a sign, if there is a symptom, do not overlook it. Go and seek for advice with a professional. There are, like you said, everybody in a social media has become a doctor now. Everybody is talking about diet, everybody is talking about disease, everybody is talking about health. But this much information is going to confuse general public rather than give more information. So I would say restrain yourself from all these things. Imagine if somebody comes and puts so much of physics into you. You're a science major, yes, you can understand physics, but you're from arts background, and if somebody puts in physics and tells you astronomy, tells you this, that, light years and gravity, 9.8 meters per second square, what would you understand? So what current present day social media status is, everybody is talking about medicine, everybody is talking about health. But what is going to be the outcome? What is the ultimate goal of knowing all these things? Are you going to live forever? Are you not going to die? Everybody is going to die. But the ideal knowledge gaining of health or medicine should be to have the transition peacefully. I would say a transition of aging, a transition of getting old, a transition of getting a disease gracefully is what I call knowledge of health and disease. So if there is a symptom, if there is a sign, do not neglect it. Do not go to internet. Do not go to Google and ask what is wrong with me, why there is a back pain or why there is a neck pain. It's always better to go and ask a doctor. You don't have to go to a specialist. You don't have to worry about a specialty. Always, my personal opinion or my personal advice to every patient is always keep a family doctor. A doctor should be, a physician should be a person who knows about you, who knows about your environment, who knows about your family, your circumstances, your financial levels. He should know almost everything about you. That is when he could normally understand whether there is a problem in your family which is causing the problem, or if there is an issue with your environment or work environment which is causing the problem. But nowadays, medicine has become worldwide. Medicine has become, even when we are not able to see each other, we treat. I would personally say don't do it.
So I keep meeting people who do doctor shopping. Yeah. They get a diagnosis and then they hop on to the next specialist, the next specialist, the next specialist. It's like they're constantly on a quest to find the right person, and then they still question the right person.
The questioning and like you said, rightly said, people are doing doctor shopping every day. Every doctor faces this. Every clinic in the world faces this. That is because everybody thinks, okay, whatever I see in Instagram is right. So I will go and ask whatever I saw from Insta to the doctor. I would say let the doctor do their job, let you do your job. If I stop an engineer and say, why are you building a bridge like this, he would definitely be not in the right position to answer me properly. So rather than going on shopping, the trust issue is the biggest problem. I basically believe in that, because everybody needs scientific evidence. Every person needs to know what is wrong with them in a paper. But nobody, for example, I'll tell you, if a patient comes in and then says if they have a neck strain, headache because of a neck strain, I would say that probably you are seeing too much of TVs or mobiles or using your computers. Change it and then go and take a rest. People are not happy. They would want a clear diagnosis. They would want to know why there is a problem in the head and all these things. There are also doctors who like you said, over-diagnosing, like saying sending for CTs and MRIs. But the understanding is, if a patient trusts me, if a patient believes me, that okay, he knows what he's doing, then there's not going to be much of a problem, I believe.
So, would you say that this consistent questioning and doubt from patients today has also been the reason which is fueling into overdiagnosis or over prescription of tests? Because everybody wants to feel that they have been really looked into. Just by saying something simple like stop watching TV is not good enough today.
To a certain extent, yes. I'm compelled to. I will give you an example. I had a patient 2 days ago who had phoned me to ask of a diagnosis called cluster headache. He typically gives me, he's from the US, so his wife calls me and says there is a typical problem of headache, as if a knife piercing his head every time on the left side. And she tells that it's just for 2 weeks, and then it goes off, it never comes back for a year, and then it comes back again. I don't get a connect in this, and I keep asking her symptoms, why it comes every 15 days. What does he do in those 15 days? He says, no, he's eating properly, he's going to the gym, he's healthy, he's working out, everything is fine. But there is no common connect for that 15 days of headache. And then she called me and said, every 15 days, whenever he goes on a flight, he's a pilot. So he's a trainee pilot. He goes for some military missions every now and then, and he drives a chopper. he flies a chopper. So I did ask, is he having a headache whenever he does that? And that's when she comes and tells me that he's a right-hander or something, he's a left-hander, so he has to sit because with his partner on the other side, so he has to strain his neck every time he does it, and that's when the headache comes. What medicine do you want me to prescribe? So he has been prescribed medicines for cluster headaches, for migraines, for headaches. They have run CTs and MRIs for tumors in the brain and all those things. All I had to do is to ask them to go for a physiotherapy or a myofascial release, what they call in the US, and patient is much better. So you don't need medicines for it. You don't need anything for it. The trust and understanding between the patient and the doctor is more important than what actually you diagnose. So the problem lies in two different aspects in this when you see. Part with the patient, part with the doctor. If the doctor is smart enough to diagnose what is wrong with the patient, then you don't have to ask for trust. And if the patient knows that the doctor knows what he is doing, then there is no problem about doctor shopping or finding who is right, who is wrong, or writing in papers and all those things. You don't need an MRI to find out there is a neck strain when you go on a drive on a chopper.
And this is why the concept of family physician is important.
Exactly.
Because the convenience or the comfort of talking freely then kicks in.
Yes. Speciality is devised to actually give more concentration to one particular part of the body. Whilst you study, then it's obviously understood that one doctor cannot be a specialist in everyone. But a family physician can know what might be wrong in the heart or what might be wrong in the brain. So he can be the right person to refer you to a specialist. So I would personally suggest, especially in India, for instance, you always have one person as a family physician. Irrespective of what stream they belong to, what specialty they do, don't care about all those things. There should be one person who knows who you are, who knows your family, who knows your mother, father, grandparents, or your in-laws, your work environment, what you do. So it's very easy for us to actually understand what could have caused the disease, rather than diagnosing a patient with about 150, 100 blood pressure and then put them on medications. But if I come to know that he's having a stressful environment in his workplace, obviously it's going to cause pressure for him. So I could give him some more time and ask him to come back again after 2 weeks, or at least go for a break and then come back after 2 weeks to monitor his blood pressure. I have the liberty to tell all these things when I am a family physician. But if I don't know you, I'm totally new to you, and if you ask me to give you advice on what is your problem, how am I supposed to know it? And how another doctor is supposed to know what is wrong with you? So obviously I will rely on tests, I will rely on diagnosis, and then I will rely on medications to put you through. Because I'll give you an example. The anxiety of letting go a patient with 150 by 100 blood pressure, saying no problem, it could be because of your work environment, it needs real guts for the doctor to say this. Is because 150, 100 can cause anything. It could cost your heart, it could cost your brain, or it could break an artery in the brain, can cause a stroke, it could damage your kidneys. We didn't know how long you've been having this, how far you're having this. So it gives me a dilemma to actually make a decision to what I should do to you. Imagine if I know you very well and I know your family and you had a family issue which is causing more blood pressure. I can more confidently say and ask you to go and come back after 2 weeks without medication. Or I could ask you to drink some water, drink some substances with magnesium, or like what you see in the internet. Let's come back to the social media and say, eat garlic, have a breathing exercise, go on a short trip, go relax yourself and come back after 2 weeks and see if your blood pressure is high. Then we can decide whether you put you on medications or not. But imagine a specialist who doesn't even know who you are and asking him to let you go with 150, 100 without tests is actually a risk on either side. So that's why I presume that doctors overdo tests in circumstances like this. So to solve all these problems, catch hold of one doctor, be with him, be with that person for a long time. You tell all your problems. Eventually, it's not that as soon as you walk into the clinic, you're not going to talk all your problems and everything. Once you get to know the doctor well, once the doctor gets to know you well, obviously you'll be able to in a position to talk about all your problems to them. So doctor understands very well what could be the problem.
So, a diagnosis cannot be purely done just on physical symptoms. They have to be an emotional connect.
All problems, according to me, are emotional connects. There cannot be a body without a mind. There cannot be a mind without a body. Mind, when I say mind, everybody should understand mind is not what is inside, it's brain. Mind is everywhere. We call it as consciousness, somebody call it as mind, somebody call it as understanding, somebody call it as knowing everyone. So this consciousness is what is driving you into your physical state. To be very clearly and precisely telling you, imagine a room packed with 5-6 people. Imagine a tiger walking inside the room. If the door is there, if the tiger walks in, the situation or the circumstance is same. It's same for you, it's same for me, same for everyone. But imagine the mind, what is going through your mind is totally different from what is going through in my mind. Probably the person who is very close to the tiger could be very scared and anxious. Further away, I am further away to it. I could find a door away and I can think that I could run away from the tiger. So my reaction to that stimulus is totally different from how you react or another person react. This holds good for every single disease in the body. There can be high blood sugar, it's because of the mind. There can be high blood pressure, it's because of the mind. Like we discussed the cockroach story. The cockroach comes and sits on your shirt. The way cockroach is same. Cockroach sits on everybody's shirt. But how are you going to react to that cockroach is what determines the situation. Either you want to escalate it or you want to de-escalate. It all depends on how well you react to that situation. So mind is connected to body and body is connected to mind. So without mind there is no disease. Without disease there is no mind.
On this topic of, you said that social media may even tell you to have garlic and that's something you can adopt. There seems to be this trend of dieting.
Yeah.
Would you like to talk about that?
I would say that the whole concept of dieting is a misnomer. What is dieting? What are you actually trying to say in when you quantify it as dieting? The problem with today's diet is we have completely forgotten about how to eat, what to eat, and when to eat. Years together, we have been doing this right, and now for the recent past, everything has changed. I see a lot of posts which comes up with eat only protein diets, eat lots of fats, leave carbohydrates completely. It's absolutely absurd. Leaving everything is wrong. You have to include everything into your diet. That's why we brought in a concept of balanced diet, which I don't see anybody ever talks about balanced diet today. Balanced diet is, you remember when you studied in school, I still remember in school and college when they draw a plate and then they divide portions of how much carbohydrates, how much proteins and how much fat has to be taken. That is true for everyone. Imagine what is different now and what is different then. Nothing has changed. Everything is true. Your body, your mind, your ability to adapt is always evolving. So people come and say, if somebody comes and says that completely stop carbohydrates, I would say that's wrong. If somebody says only take fats and protein, that's also wrong. Your body needs carbs, your body needs proteins, fats, minerals and vitamins. But it has to be on the right quantity. When I say right quantity, please always remember right quantity is not universal for everyone. For instance, if I say 100 grams of carbohydrates is right for me, it is right for me. It need not be right for you. It need not be right for another person. I'm sitting in the clinic from morning till evening. I don't do any physical activity at all. 100 grams of carbohydrates is much more than for me for the whole day. But imagine a person who's driving, who's running around, who's lifting weights for his job. If you ask him to go and eat 100 grams of carbohydrates, you're doing absurdity. You're depriving him of energy. So what happens when you deprive a person of energy, easy energy, which I'm saying, glucose, carbohydrates are the easy energy which you need. If you deprive that person of easy energy, you would automatically go into lean muscle reduction and then the fat reduction. This is what happens with exercise as well. So dieting is a wrong concept, and there is another concept which I'll highlight about fasting. Now there is another big group which says fasting is good, fasting is that, fasting is this. There are different forms of fasting as well. Intermittent fasting, water fasting, dry fasting. I don't get all these things. If you're not hungry, you don't eat. If you're hungry, you eat. If you want to have fast, you have a systematic fasting. Systematic fasting, intermittent fasting is not an Indian concept. Mind you, intermittent fasting came from the Western countries. Indian fasting is what your mother, my grandmother did when they went to temples. They say on Tuesdays they fast in the morning, they eat in the afternoon. On Fridays they don't eat in the whole day and then eat at night. That is fasting. That is much more than enough for fasting what everybody does in our household, rather than you adapting something new, alien to us, which our body doesn't know, which our DNA doesn't know. You eat whatever you want to eat, but eat in the right quantity, eat in the right portion, right way of eating. If you ask me to change things, how I will look in dieting, I would definitely say carbs, proteins and fats. I may change the pattern of eating. Probably I would say eat the fibers first, and then the proteins and fats, and then last the carbs or sweets. This could be altered, but you can never say don't eat carbs or eat this, because everything is biochemistry, everything is a metabolism in the body. So if you add more, it is going to cause more problems. If you add less, it's going to cause more problems too. So on the right quantity, how to decide the right quantity is up to you, because it's up to you, to your dietitian or to your doctor. And if your dietitian or your nutritionist says that no, leave all these things, that's wrong. That's time to change your nutritionist or a dietitian.
So, doctor, you spoke about eating habits or adopting habits which are sustainable. But, you said that we can change the way we eat. Correct. But Indians, as Indians, all of us, we tend to start our meal with carbs.
Yeah.
So, how can changing that will be sustainable for us?
Yeah. Okay. Now, this is a good question, is because whatever the way of eating carbs and proteins and fats actually comes from a Western concept. The Western concept of understanding eating your fibers first and then your fats and then carbs is easy, because they have a separate bowl of salad. They can have steaks or porks or beefs or anything as a source of protein or fat, and then they can finally have carbs to it, or they can even have a dessert. But the problem with Indian pattern of eating okay, let me give you an example or understanding about how to eat this. What happens is when you eat fibers first, it actually helps as if coating the intestines and coating the stomach lining, so that it takes more time to digest the carbohydrates when you take it at last. This is the whole understanding about stopping insulin hikes. Insulin spikes are, I hope everybody knows about insulin spikes. Like when you eat a sugary meal, there's a sudden spike of insulin in your graph and then it comes down.
After any meal or just sugar?
Every meal is, at the end of every meal is energy. The end of every meal is sugar. So every meal will end up giving you energy. But how fast it gives energy is what you call it as a glycemic index, or the spike of insulin or spike of glucose. So when there is a sudden spike of glucose in the body, then automatically there is insulin which is triggered, and the insulin comes and neutralizes the sugar in converting it into energy, and then energy is released, and then the spike comes down, the graph goes down line, and then comes back to your normal blood sugar level. This is what happens with every person in the body, every person in the pattern of eating. But what happens, what they have found with biochemistry is, like when you eat the fibers first, the amount of energy released from the fibers can be zero carb diets, like your spinach or your green leafies, which does not produce too much of sugar into your body. So they are called as fibers, which are mostly fibers. And then fibers are most partly digested, partly not digested, because we lack an enzyme called cellulose. Cellulose is not present, so that we cannot chew all these leaves and digest it. So it just takes longer time for digestion. And after that, when you load it with proteins and fats, last, if you add carbohydrates, then the time duration taken to digest carbohydrates is actually diluted so that you don't get a glucose spike. So this is the whole concept about eating differently. There is also another concept called dressing the carbs, like you said, like we discussed. Dressing the carbs means you're not eating the carbs as it is. If it is rice, then don't eat the rice like that. If there is bread, don't eat the bread like that. So what do we use to dress it? I would say the Indian concept of eating carbohydrates is the best concept in the world, because you don't eat carbohydrate rice like that, but you eat rice with either you add ghee to it and then you add dal to it. So this is what we call as dressing the carbs. So you add ghee and then you add dal to the carbohydrates so that it neutralizes the amount of glucose spike which your body is going to get when you eat the carbohydrates. So if you go, you see a banana leaf treat when you go for a wedding or when you have a festive season in the house. They give you fibers, they give you vegetables which are not fried, cooked. There's also a part of vegetable which is fried as well when you take potatoes and stuff like that. And there is rice. And they put ghee to it, and then they put dal or sambar to it, which we call it as dressing. And the Western concept says every sugary meal should have yogurt. Greek yogurt is the best thing which they do. We already do that. We put rice and then we put yogurt on top of that and eat it. So I would say the Indian, or especially the South Indian form of eating is perfect. North Indian as well, they also eat rice, they also eat wheat and everything, but they dress the wheat with ghee and they dress the wheat with dal and all this stuff. So there is no wrong in the way we eat, but there might be a mistake in the amount of carbohydrates which we eat. So I'm not saying that you have to adapt a Western concept of eating the pattern which we eat. The Indian concept is perfect. You are perfectly eating normally, but the amount of carbohydrates in your diet could be a culprit. So people has to decide on themselves on how well they are using these carbs. For example, if a sedentary person wants to eat a full meal with a cup of rice for sambar, a cup of rice for rasam, and then for curd, that could be a wrong concept. So you have to calculate your number of carbs you eat in a day so that you divide it, space it equally whenever you're hungry, and then add and dress it and then eat it. So I would still say Indian form of eating is a very good form of eating when it comes to carbohydrates. What other problem happens is the mobility after you eat. If you ask me what is the best way to diet or what is the best way to lose weight, I would first see how well you're mobilizing yourself, how well you're walking around, how well you're physically moving around in your line of work. If you come back and say, no, I'm not moving much, most of my work is seated on a chair or on a table, on a desk, I don't move much, then I would definitely ask you to reduce the amount of carbohydrates you take. In fact, the amount of carbohydrates, proteins, fats, everything has to be reduced proportionately. And the easiest way to do is after you eat, you go for a walk.
But doctor, I know a lot of people in my society who are a part of WhatsApp groups and Facebook groups which promote keto diets or paleo diets, and they do lose weight. So, I mean, weight loss is a perennial struggle. I myself have been trying to lose just 10 kgs and it's been like 3 to 4 years and I've still not succeeded.
The easiest understanding, if you have to understand weight loss happens or not, is by weighing your weight every day. The weight cannot be standard. The weight fluctuates. The weight fluctuates is because if you eat carbs, you drink more water, so your water gets logged there and then you increase weight. And then once the water is drained off your body, and then you lose weight. So every different part of the day, there is a difference in weight, say about a kg or 1.5 kgs of weight. The difference is definitely there in every person, every day. If you have a standard weight, then there is a problem. I would say if a person struggles for weight loss even after all these calorie deficits, reducing carbs, exercises, then there is a problem in the person, not just because of the food or the diet or the way they do it, but there is definitely something else which is causing weight gain. So we generally, layman terms, we call it as inflammation. Medically, we call it as imbalances in your hormones, imbalances in your nutritional levels. So once that is corrected, it can easily bring you weight loss.
So what are the specific kind of tests that you would recommend to identify the core problem for weight loss?
The problems for weight loss is the calculation. Personally, my opinion is, your calculation of weight to your height is wrong. On an average, everybody thinks that if you're 175 centimeters, you take 100 out of it and your ideal weight should be 75. No, as age advances, this equation changes. If you have diseases, this equation changes. If you have hormonal imbalance already, this equation changes. So there is no specific formula for saying you take 100 out of your equation and then the rest is going to be a weight. No, that is wrong. Now, coming back to your problem, if there is a persistent weight gain issue where even in spite of all these changes in your diet and exercise is not helping you, then you'll have to identify what is causing this problem. Women, on a general note, very easy to identify is hormonal imbalance. Thyroid is the first culprit, I would say, which causes more weight gain.
I have thyroid.
Yes. So the thyroid is what is troubling you from not letting your pounds go off. So thyroid has to be treated first in order to get an ideal weight. Rather than leaving the cause, if you still ponder upon eating habits and exercises and stuff, it's not going to help you at all. It's going to cause more problems to your body rather than good. The other is cortisol. Cortisol is called as a stress hormone, where you get more pounds on your hips and backs and thighs, which is very common, where you get a pear-shaped belly, where your body gets more fat deposited on the sides and belly areas, which is a very dangerous hormone, which is secreted when your body is constantly under stress or inflammation or threat, and it gets accumulated. It's very difficult for you to chase it away from the body. So these are the causes which you have to find out personally to find out why there is increase in weight or why you're not losing weight.
And specifically, why are you talking about the fact that a keto diet or a paleo diet may not be good even if you are losing weight temporarily?
On a shorter period or a shorter duration, yes, it could be able to help you. There are medical reasons as well as physical or emotional reasons to it. If you ask me what is the medical reason, proteins are a very good source of energy. Fats are also a very good source of energy. So are the carbohydrates. But what are you going to do with the byproducts of proteins accumulating in your body? Where is all this ammonia going to go? Where is all these ketones going to go? When the byproducts, when the protein is disintegrated and it has to be stored somewhere as a byproduct, so eventually who is going to get strained? Your liver and the kidneys. So kidneys at some point of time will be happy to push all these outside, and at one point of time it will say no and push you back again. So your body is in an acidic state, which nobody wants to do it. That's what happens with high diabetic patients. When the blood sugar goes unbelievably high, patient goes into ketoacidosis. It's a very dramatic as well as a very grave medical complication called diabetic ketoacidosis, where what happens is the normal glucogenesis doesn't happen, so the body takes energy from fats and proteins, gluconeogenesis, and the byproduct of it is ketone bodies, and the ketones, to a certain extent, kidney pushes the ketones out, and if it cannot push it out, it brings it back into the bloodstream, and when it crosses the blood-brain barrier, then you go into coma. And reviving a patient from diabetic ketoacidosis is a very hard task for any doctor who practices. So you don't want to put your state in an artificial ketoacidosis by bringing more proteins into it and not taking carbs. So this is actually, you're trying to create more problems than good. Now coming to the emotional point of view, you are restricting yourself from the most easiest food what you could get, which are carbs, which are rice. From the day you were born, say maybe probably about 6 months after you start weaning from your mother, you started eating carbohydrates, be it mashed potatoes or be it rice or dal or whatever it is, it was carbohydrates in your body. So your body is in par with the carbohydrates which is present in the environment. If you take this off suddenly from your body is going to go under stress. Imagine how difficult it is for me to see rice, and I like eating rice, and I'm seeing rice which I cannot eat it. And this gives a big toll on my brain. Maybe for a few months it'll be nice, it'll be good. You'll see a lot of pounds losing in your body and you'll be happy, energetic, and all these things will happen. But at the end of the day, after 6 months, will you be able to continue this? You should have a lifestyle pattern with diet and exercise and sleep patterns which you are able to sustain it for a very long period of time, which should not take a toll on your body, your mind, or your environment. Imagine you're going for a festival, you're going for a function or a marriage function in your family. Will you go and sit there and say, no, I'm on a keto diet and I don't want to eat all this rice and stuff like that? You should be adaptive, you should be flexible enough to eat whatever comes into you. You may reduce the portion what you're eating, but you should not, I would say, you should not avoid whatever you're eating. Because your body is going to automatically go into stress when it thinks that you're not able to eat the food which you like the most. Imagine if everybody likes biryani, and if somebody wants to eat biryani, but they're not able to eat it because they're on a keto diet, that is absurd. So your body is actually, your happy hormones are wanting it to eat, but you're not able to eat. You're forcing it from not giving the pleasure of eating it. Eating, you're living for eating. You're living, all your basic needs is shelter, food, and then your physical need. And you have a shelter, you have a beautiful place to live, but you cannot eat what you want to eat. Then why do you want to earn? Why do you want to live? What is the purpose of living then? So I would say a diet pattern should be very comfortable for you, very easy for you, and very adaptive for you. Nobody else should change you, and you should not change for anyone else. The pattern, the amount of quantity of carbohydrates can be reduced. I emphasize on this again and again. The quantity can be reduced so that you go on a calorie deficit, but you cannot avoid it completely and then stick yourself with proteins and fats.
Doctor, is it true that when you are following such exclusion diets, over a period of years, your body develops an aversion or an intolerance towards certain foods, which causes a lot of allergies and skin breakouts and such things?
Yes, it's true to a certain extent that one type of food or single form of eating will actually lead into a state of satiety, which means if you start eating sweets, you're eating sweets every day, nothing else you're eating in the body, then at some point of time your body is going to create aversion to that sweets. Same thing holds good for all forms of food like proteins or fats. Imagine eating proteins I have seen lots of videos and posts and podcasts which says carnivorous diet, where people only eat, they even attribute it and say that we were about 5,000 years ago, we were hunters and gatherers, we ate only meat, our teeth were designed for all these things. But imagine mankind has evolved all these years. So you have to adapt to a certain extent to what the mankind has evolved into, and your body has to adapt to that. It's not that you're not eating the meat what 5,000 years ago men eat. So like you said, if I keep eating proteins for a very long time, automatically my body is going to get aversion to such kind of proteins, and then definitely there are going to be deficiencies in it, like minerals, or there are going to be zinc, selenium, all these micro minerals. These micronutrients are not available on certain types of foods. For instance, we drink lots of milk, there's no vitamin C in it. We actually have to get vitamin C out of somewhere. So these kind of problems do present in a body which actually follows this kind of food. So automatically your body will push this out and then will want you to eat normal food.
Doctor, I want to touch upon this, perpetual discussion which goes on about whether a vegetarian diet is good or a non-vegetarian diet is good.
Yeah. Very good. Actually, there is I keep persistently insisting on the fact that every individual is different. I may be different from you, you are different from me. So even we call a common name for what we eat, let's keep it a sambar. The ingredients which you or your mother has been putting on that sambar is different from what my mother has been doing it for a long time. So my body has been following what my family or my pattern of eating for a very long time. Similarly, when you ask me to suddenly change into a different food pattern which is alien to me, which is going to cause problems to me. If you ask me which is right, which is wrong, there is no right answer, there is no wrong answer for this.
But isn't it true, doctor, that vegetarians have lower access to protein-rich foods?
The animal proteins are high source of proteins, and it's an easy source of protein. So the amount of meat which you have to eat to get certain amount of grams of protein is much lower than compared to the vegetable proteins which you eat. So imagine you eating green peas or chickpeas. Quantity of chickpeas to produce so much amount of protein is much more than the amount of protein when you get from meat. So what I suggest is, personally, there is no rule to say this is better, that is better. If you could incorporate both vegetarian and non-vegetarian into your diet, that is fantastic, because non-vegetarian is a good source of fiber, good source of minerals, microminerals like zinc and selenium comes from vegetables and green leaves. Easy source of protein comes from minerals, meat source. So you have to have a blend of vegetarian and non-vegetarian together. But there is no hard and fast rule which says that you have to have vegetarian, you have to have non-vegetarian. You should have a blend of vegetarian and non-vegetarian together. In certain conditions, when your body is constantly under stress, like there is an experiment which was conducted on cancer patients, a condition called autophagia, which was awarded the Nobel Prize for 2016, I think. The autophagia happens when your body goes into dormancy. So when your body is deprived of energy, you go into a state of hibernation. In that part of hibernation, your normal cells restrain the energy into the mitochondria and then keeps the cell wall intact, while the cancer cells or the deranged cells dies by itself. So this is a concept which brought in this intermittent fasting and fasting concepts. But the Indian concept has already incorporated fasting in your diet, fasting in your lifestyle. You follow fasting the way which adapts to you. Imagine there are so many patients who come to me and say, if I start fasting in the morning, I get headache. That's very normal. So if you cannot fast, then don't fast. If you want to fast, then there is a window for intermittent fasting where they say 16 hours of fast and 8 hours of eating. It's very difficult for a normal professional to follow this. At least it's difficult for me to follow it. And that's what I hear from most of the people. It is kind of a compelling pattern that you have to be on this for this. That's not how life has to be. Life has to be very smooth, very happy, and life has to be very peaceful. Now, you're not at peace when you're struggling to do something which is very nice and happy to do. Imagine if somebody goes and asks you to watch a movie and then they say, no, you have to be very stern, you have to be very strict, you cannot laugh in this part when there is a joke comes in, you cannot cry when there is an emotional scene. How will you enjoy a movie? Your life has to be like a movie. You have to eat something, you have to enjoy doing it. If you're talking with somebody, you have to be in peace with them. So that is where the understanding and the emotional connect comes between two people. This happens between the food which you eat and the person who is eating the food, the way you eat. Imagine being it very hard for you thinking about going and eating. It's definitely going to cause weight loss, but it's not going to give you a happy ending.
So, doctor, you're saying that in general, for our health to be good and for us to live longer than to die longer, it is important to be easy on yourself and stick to whatever conveniences you.
Pretty much that's the whole answer. You have to live. The longer concept is also a very alien concept to us. What is longer for you? How long do you want to live? Everybody should ask this question now. Everybody who thinks about life, everybody who thinks about health should always have this concept in mind. How long is longer for you? Is 120 years longer for you? Is 100 years longer for you? And how long is healthy for you? Then you should not age. Aging should happen in the reverse, like what nowadays people wanting to. My concept or everybody's concept should be very simple. You never know when you're going to die. If you know that you're going to die tomorrow, today is going to be hell. So emotional concept, even you can call it a spiritual concept or psychological, philosophical concept, however you want to name it. The day until you die, you should have a very peaceful, healthy life. Health is a concept. Health is relativity. Health, I cannot compare my health. I cannot compare health with something else. I have to compare health with your health. Health is relatively, in comparison to a person of my age, I'm healthy. In comparison to me, somebody else is healthy. Apparently, if you have a very peaceful, self-sustaining life till you die, that is healthy and long life, like everybody wants. But everybody should have a quantification to understand what is long, how long you want to live, and how healthy you want to live. Even to put it in plain, simple words, death should be a peaceful transition of a spirit or a consciousness from this body to a different dimension. We don't know whether there is life after death or there is heaven, hell. We don't have to go into all those things. But life from this body has to go at some point of time, and that transition should be very smooth, which means it should not trouble this body, and this body should not trouble anybody else around us. So I should not be disabled. I should be able to walk till the day I die. I should be able to do all my activities till the day I die. I should be able to eat, laugh, smile, and sleep before the day I die. So this is what I would quantify it as a healthy life and a long life. If you are suffering from diseases, yes, we have to treat you. But the concept about thinking too much into the future and getting a long life and a healthy life, to achieve what, is a question to be asked by everyone.
But isn't this what is preventive healthcare? Everybody goes on about preventive healthcare today.
What do you want to prevent? I might sound philosophical again, but what are we going to prevent? Are we going to prevent heart diseases? Are we going to prevent diabetes? Are we going to prevent kidney failures? Are we going to prevent strokes? If we are able to find a pattern which would prevent everybody's heart disease, if we can find a methodology which prevents everybody's stroke, then there cannot be death at all. Death is inevitable. Disease is inevitable. What is death? Death is the end. But what is the process of that death? Disease is the process of the death. When do you want to have that disease is the question. Whether you want to have an unhealthy lifestyle at 30 years and then die at 60, so that 30 years of life with disease is going to be hell, or you have to have a disease at 60 years and then you're going to die at 70, that's fine. But preventive is exactly the question what you're going to prevent. Probably let's argumentatively have that my parents had heart diseases. So probably I will get heart disease. So I should go and get something preventive to stop me from getting heart diseases. But is that going to be it? I'm going to get something else if I'm preventing heart diseases. So I should gracefully understand what is going to cause the problems. So I would personally say there's nothing we can prevent. There is no preventive at all. You can postpone it, but you cannot prevent it.
So, would I be right in saying that early diagnosis is far more better concept to understand or adopt in life than preventive?
Perfectly right. I would say diagnosis is the key for everything. If you know what disease if I don't know the enemy who I am fighting with, there is no point in fighting. I don't know the strengths and weaknesses of whom I am fighting against. So every doctors, everybody, every healthcare professionals, ideal goal should be to find out what you're fighting against. What is the disease? What is your diagnosis? Unless and until you get that triangle right, you're not going to treat anything. I don't have to treat. Imagine if I'm able to diagnose a case perfectly as soon as I see the patient or get everything done, anybody else can treat it. Any doctor can treat it. But treatment is very simple. Diagnosis is difficult. So always find out what's wrong with the patient. Dearrangement most of the time settles by itself, or somebody else will treat it.
This is very interesting because I have a lot of colleagues and friends who day in and day out, I hear them say, I have a back pain in the morning. I have, say, nausea in the morning. I vomited or something like that. But yet they don't opt for intervention. They don't go and meet a doctor. Yes. And they feel, no, if I do this, I feel better after an hour. And it's more of self-diagnosis they do. But like just yesterday, I realized that a friend of mine who I've been telling to go and meet a doctor 6 months back because she has this back pain every morning has now been diagnosed with something so serious where she's under steroids.
Yeah. No, this is the most easiest and the probable mistake with every person, be it doctors, non-doctors or non-medicos. Everybody does it. They think that it's okay. It'll go by itself. I would say it's always better to go and speak with a professional, a doctor, to find out what's wrong. Whether you want to take treatment for it, whether you don't want treatment, you want interventions, you don't want interventions, is up to you. But to know what is wrong with you, you cannot diagnose yourself. There are certain things which you can think you might be having, but that need not be the right answer. So you have to find out the right answer. So you need to go and find a professional to know what is wrong with you. And once you're knowing what is wrong with you, going for a treatment or not treatment, you want a surgical intervention, not an intervention, it's all up to you and the doctor who is treating it. But unless and until you understand what is wrong, you're not going to take a remedial measure. By the example which you say, if somebody had a back pain every day when they're morning, they get up, when they go to the gym, in spite of that pain, if you keep doing exercises, if you keep lifting weights, you're going to damage your back much more than when you are not doing it. So once there is a symptom, once there is a sign, it's always better to go and find an expert and know what is wrong with you. Correction is up to individual. Self-diagnosis is also wrong. Over-diagnosis is also wrong. So knowing something is wrong with you is consciousness. Treating or not treating is totally up to you.
And this is where the concept of family physician comes in, because you can always go and talk about every little thing, and it's okay even if you seem paranoid. I had this pain, I had that pain. It's okay. It's okay to share it.
That's why he's there. You slept in a different way. You drove for a very long time. Your traffic was bad. You had a back strain, and then you think it might be a disc prolapse. You go to your doctor and you tell what it is, and then he asks you to bend forward, bend back, ask you to raise your leg. Then he says, "Don't worry, it's just a muscle strain." Everybody's happy. But if you think it's a muscle strain, and if it is a disc bulge which is compressing your nerve, then everybody's making a mistake. So if the mistake is done by a doctor, it's very rare that the doctor does a mistake. Even if he does a mistake, there'll be another doctor to correct it. But if you do a mistake, how am I supposed to know what is wrong with you? By seeing you at the outstretch, I think everything is okay with you. But if you had a common cold, if you had a fever, you have to tell me what it is. There are symptoms like sneezing, which is very obvious that you sneeze. I know what is wrong with you. If you have a back pain, how am I supposed to know whether you're having a back pain or not? But the moment I see you, I seem everything okay. So it's the duty of every patient or every person to know what is wrong with themselves, not what is wrong with the others or what others say right or wrong. If whatever you're doing, your regular activities are compelled, your regular activities are disturbed, then there is something wrong with you. It has to be consulted with a doctor, not treated. I'm putting my words very correctively. I'm saying consulted and not treated. It's because treatment is different, consultation is different. You go and talk to somebody who knows what it is. Yes, you have a problem in your laptop. What did you do? You would definitely, you wouldn't, you see, would you be daring enough to open a MacBook and then do some solderings and putting some wires together, or would you take it to a Apple store? When a product which is costing you 1-2 lakhs, you're very cautious. You take it to an Apple store and say, no, I don't know what it is. You do it. That is because you want to safeguard that product. But you are a product. You are a very valuable product for yourself, at least. Forget about your society. Forget about what you do to the nation. All these, just leave it as that. For you, yourself and your family, you're a very good source. You're a very protective product. And what you do, you go to YouTube's and find out, oh, this is not a tumor. No, this is just a lump. That's what we do. So always better go and talk to an expert. Any doctor is fine. Now, I'm not too much worried about your degrees, your rankings, hierarchies. Forget about all these things. Just go to a doctor who stays in your place. Just a corner, walk into him. He may charge you 100, 500. Doesn't matter. Spending 500 on your body to know what is wrong with you is not going to cost you anything at all. Sit with him, talk for a few minutes, tell him what is your problem. He's going to tell you whether to take treatment or not. So please have a family physician is the only ideal way to go ahead for the future.
Doctor, thank you so much for coming in today, and this has been a very enlightening conversation, and I truly hope that everybody who's watching this has learnt something and has something to take away home.
Thank you, Rashmi. Thank you for inviting me for this podcast, and it was a great pleasure to express my feelings and my concepts with you and with our audience, and hope let's all have a healthy and long-lasting, peaceful life. Thank you.
This concept of podcast that I've just started is very close to my heart. I embarked on this journey of understanding my health after I developed thyroid. And I wish I had paid attention to my health, early on. I assume that because my mother has thyroid, it is just natural for me to develop thyroid. But I understand now that's not true. And maybe early intervention or early change could have prevented me from developing thyroid. And this is what I'm trying to do here by creating an environment where there's enough information for you to take the right choice for your life. And for what I want in return is for you to follow me and subscribe to this channel, because your support to me encourages me to get more doctors into the ecosystem, and it will help me create valuable content which can be useful for everybody around. So, guys, subscribe and follow so that I can build this into something really big and informative that is going to be useful for everyone who watches it around the world.